Ever wondered what Crohn's disease is? Let's break it down. Crohn's disease is a type of inflammatory bowel disease, or IBD. This condition causes inflammation or swelling throughout the digestive tract. But it doesn't stop there. It can impact any part, mouth to anus, though it most commonly affects the lower part of the small intestine, known as the ileum. And what does this mean for overall health? Well, the inflammation caused by Crohn's disease often leads to severe diarrhea, abdominal pain, fatigue, weight loss, and malnutrition. It's not just a one-time event either. Crohn's disease can be both painful and debilitating, and sometimes may lead to life-threatening complications. While it's true that there's currently no known cure for Crohn's disease, there are therapies that can greatly reduce its symptoms and even bring about long-term remission. Now, let's delve into the symptoms of this disease. So, how does one know they might have Crohn's disease? This chronic condition can manifest through a variety of symptoms, and each person's experience can be quite unique. However, there are 5 common signs one should be aware of. Firstly, there's abdominal pain. This can range from mild discomfort to severe cramps, often located in the lower right area of the abdomen. The second symptom is diarrhea, which can be frequent and may include blood. Thirdly, people with Crohn's often experience fatigue. This is not just a general tiredness, but a profound exhaustion that doesn't improve with rest. The fourth symptom is weight loss. This is often unintentional and may be due to a lack of appetite or the body's inability to absorb nutrients. Lastly, malnutrition is a common issue, as the disease can prevent the proper absorption of nutrients from food. Having understood the symptoms, let's explore the causes. What causes Crohn's disease, you might ask? Well, let's dive into the 5 main causes. The first is an immune system malfunction. In some cases, a virus or bacterium may trigger Crohn's disease, as the immune system tries to fight off the invading microorganism, leading to chronic inflammation in the intestine. Secondly, there's heredity. Crohn's disease can run in families, so if you have a close relative with the disease, you may be more likely to develop it. Thirdly, environmental factors play a role. Crohn's disease is more common in developed countries, urban areas, and northern climates, suggesting that environmental factors, including a diet high in fat or refined foods, may influence its development. The fourth cause is smoking, which is the most controllable risk factor and can lead to more severe disease and a greater need for surgery. Lastly, the use of non-steroidal anti-inflammatory medications, such as ibuprofen, can lead to inflammation of the bowel that makes Crohn's disease worse. Knowing the causes, let's move on to complications. What could happen if Crohn's disease goes untreated? That's a question that many patients and their families grapple with, and it's one that we're going to explore in this segment. First on the list of complications is inflammation. Crohn's disease is, at its core, an inflammatory illness. It makes sense, then, that if left unchecked, this inflammation can spread beyond the digestive tract, affecting the skin, eyes, and joints. This can result in a multitude of health problems, from skin rashes to arthritis. Next, we have ulcers. These painful sores can develop anywhere in the digestive tract, from the mouth to the anus, and even in the surrounding areas. Ulcers can be extremely uncomfortable, causing severe pain and discomfort, and can also lead to serious complications like perforations or abscesses. Thirdly, bowel obstruction is a concern. The inflammation and scar tissue associated with Crohn's can cause the intestines to narrow, leading to blockages. This can cause severe pain, vomiting, and the inability to pass stool or gas. In extreme cases, surgery may be required to remove the obstruction. Then there's malnutrition. Because Crohn's affects the body's ability to absorb nutrients, untreated disease can lead to deficiencies in vitamins and minerals. This can result in weight loss, fatigue, and a weakened immune system, making the individual more susceptible to other illnesses. Finally, and perhaps most ominously, Crohn's disease increases the risk of colon cancer. The constant inflammation and cell turnover can lead to DNA changes in the cells of the colon, increasing the likelihood of cancerous growths. The potential complications of Crohn's disease underscore the importance of early detection and treatment. With the right medical intervention, these complications can be managed or even prevented, improving the quality of life for those living with this condition. Given these complications, prevention becomes crucial. It's not just about managing the symptoms, but also about reducing the risk of these serious and potentially life-threatening complications. Is there a way to prevent Crohn's disease? That's a question that weighs heavily on many minds. While there's no surefire way to prevent Crohn's disease, certain lifestyle modifications can play a significant role in managing its symptoms and reducing its impact on your life. Let's start with maintaining a healthy diet. While no specific diet has been proven to prevent Crohn's disease, a well-balanced diet can go a long way in keeping your digestive system healthy. Incorporating a variety of fruits, vegetables, lean proteins, and whole grains into your meals can help. Moreover, it's also beneficial to identify and avoid foods that may trigger symptoms. Next up, regular exercise. Physical activity promotes overall health and aids in maintaining a healthy weight. It can also help reduce stress and promote better bowel movements. So whether it's going for a brisk walk, cycling, swimming, or yoga, find an activity that you enjoy and make it a part of your routine. Thirdly, if you smoke, it's time to quit. Smoking not only increases the risk of developing Crohn's disease, but also leads to more severe symptoms and higher chances of requiring surgery. If you're struggling to quit smoking, seek help. There are numerous resources available to make this journey easier. Fourth on our list is stress management. Stress doesn't cause Crohn's disease, but it can exacerbate symptoms and trigger flare-ups. So it's crucial to find effective ways to manage stress. This could be through relaxation techniques like meditation, deep breathing, and yoga, or through hobbies and activities that you enjoy. Lastly, regular medical checkups are a must. Regular screenings can help identify any potential issues early and monitor the disease's progression if you have been diagnosed. Your doctor can also provide you with personalized advice and guidance based on your specific health situation. Remember, these preventive measures may not prevent Crohn's disease, but they can certainly help manage its symptoms and reduce its impact on your life. So take them seriously and incorporate them into your lifestyle. And finally, let's discuss the treatment options available. How do we treat Crohn's disease? The answer lies in a multi-pronged approach, tailored to each individual's needs. Firstly, medication is often used to reduce inflammation and manage symptoms. This may include anti-inflammatory drugs, immune system suppressors, or antibiotics. Secondly, nutrition therapy can play a vital role in managing Crohn's. A balanced diet, possibly supplemented with vitamins, can help maintain nutritional balance and potentially reduce symptoms. Thirdly, in severe cases, surgery might be considered. This could involve removing damaged parts of the digestive tract to bring about long-term remission. Fourthly, lifestyle changes, such as regular exercise, adequate sleep, and stress management, can contribute significantly to managing Crohn's disease. Lastly, joining support groups can be highly beneficial. Sharing experiences and coping strategies with others who understand your journey can provide emotional strength and practical guidance. In essence, the key to treating Crohn's disease is a personalized, comprehensive plan. With these treatments, managing Crohn's disease becomes a more achievable task. So, what have we learned about Crohn's disease today? Well, we've delved into the world of Crohn's disease, a complex and chronic inflammatory bowel disease that can affect any part of the digestive tract, from the mouth to the anus. We've uncovered its symptoms, those being persistent diarrhea, abdominal pain, blood and stool, reduced appetite, and unexplained weight loss. We've also explored its potential causes, from genetics and immune system malfunctions to environmental factors. We've taken a sobering look at the possible complications, including bowel obstruction, ulcers, fistulas, malnutrition, and even an increased risk of colon cancer. But it's not all doom and gloom. We've discussed the ways to prevent the disease, like maintaining a balanced diet, exercising regularly, and avoiding smoking. And when prevention fails, we've learned about the various treatment options available, from medication and surgery to dietary changes. Remember, early detection and treatment are key in managing Crohn's disease. Stay informed, stay healthy.